Hello everyone, welcome again to my channel. I am Dr. Zina. Today we'll be talking about a very important topic, Ludwig's angina. But before we continue, make sure to hit the subscribe button down below for more videos. Ludwig's angina is a bacterial infection referred to as cellulitis, not an abscess, that affects your neck and the floor of your mouth. Hence, it's not contagious, and it typically starts from a tooth infection, which is an abscessed tooth. If left untreated, it can result in Ludwig's angina. And this rare type of cellulitis, it can spread rapidly, causing life-threatening swelling that can affect your ability to breathe. So it's not like an abscess. Abscess is chronic, whereas cellulitis is acute. It spreads rapidly and it is life-threatening as well. Now, how can you remember is that Ludwig, the letter W, you can flip the W, it will become M. So it is an infection in the submandibular and submental space, commonly located between the lower, second, and third molar. So it is all M's. Okay, so it is an infection in the mandible. Infection in the mandible is the Ludwig's angina. So these are the spaces in which there is an infection in them, leading to Ludwig's angina, which is the sublingual space, submandibular space, and submental space. So we have two M's and one L, all leading to Ludwig's angina, because you know the Ludwig in the first letter is L, so L for lingual, and M, which is W, flip it to M. What are the symptoms? As you can see in the picture, pain or tenderness in the floor of the mouth, and you will have an elevated tongue toward the palate, so the patient will have asphyxia, together with swelling, as you can see. So this large swelling, whenever you see this swelling patient is having, especially in the mandible, this is the patient is having, you need to know that the patient is having Ludwig's angina, together with elevated tongue toward the palate. Now, the cause behind it, as I said previously, which is Ludwig, W, flip to M, M molar, because it is L, Ludwig, so lower molar, which one? Commonly, the second and the third molar. So if you have a dental infection, lower second and third molar, you need to treat it as soon as possible so that it will not spread, the infection will not spread into the spaces, the sublingual and submental and the sublingual spaces, thus it will lead to Ludwig's angina. So whenever you have infection in these teeth, you need to treat it as soon as possible. If it is root canal treatment or simple cavity as well.
It doesn't have a hot potato voice. Let's open your mouth now. Open your mouth and stick out your tongue. So you can see on the base of the tongue down there, there's some swelling underneath the tongue.
Now, what is the treatment for such cases? Since it is a bacterial infection, so we give an antibiotics. That's number one. And because we have an abscess that is surrounding the lower second and third molar, so we need to do an incision and drainage for the abscess in order to relieve the pressure from the patient. And because the patients may die because of asphyxia, so airway management is a priority, because during the Ludwig's angina, the tongue will be elevated toward the palate, and this will restrict the normal breathing for the patient. So airway management is a priority for such cases.